to today's press briefing. Today we have Dr. Albert Au, Principal Medical and Health Officer, Mr. Daniel Chung, Assistant Government Chief Information Officer, and Dr. Gladys Kwan from Chief Manager of Hospital Authority. Good afternoon, everybody. I will be reporting the 2019 COVID latest information, and then Dr. Kwan will report on HA, and Mr. Chung from the Chief Information Officer will talk about the vaccination pass phase 3 progress. Now, yesterday we had 125 PCR positive cases, including 23 reported from HA, 13 from public laboratories, and the remaining 89 from private laboratories. Yesterday we had 150 RAT positive cases, and yesterday Hong Kong recorded 275 positive cases, and the accumulated figures are 1,199,739, and we have also cases from PCR testing and 450,000 through RAT testing. Yesterday in the positive cases, 48 are imported and 37 were detected at the temporary facilities at the airport. 10 cases were found at the quarantine hotels, including one, 3 from the third day, and 2 from the fourth day, and 4 on the fifth day. Yesterday we had a case detected on the 8th day in the community, and it involves a 19-year-old male. Now, we believe this is a reinfected case. He had 2 vaccinations, and in January, he was infected in the U.S. On the 22nd of May, he returned to Hong Kong from the U.S., and he stayed at the quarantine hotel till the 28th of May, and he had to return to the mainland, and his sample was tested positive, but the CT value was larger than 30. In the imported cases, yesterday there were 9 cases from the US, 8 from the UK, 4 from Singapore, 4 from Australia, 2 from Canada, 2 from Taiwan, 2 from Indonesia, 2 from Spain, 2 from Poland, 2 from the Philippines, and the remaining countries, including Pakistan, Cambodia, Mozambique, Italy, Ireland, Switzerland, Mexico, and Germany each had 1 case. At the residential homes, one residential home reported 1 staff member being infected, and another physically disabled residential home involving 1 patient reported 1 case. The schools this morning, after leaving school from last Friday till this morning, we received 45 cases being reported involving 34 schools. Now, these 45 cases include 37 students and 7 staff. 40 cases were detected by RAT, and 5 cases from our PCR. 6 cases were from the Canadian International School and Dang Pui King Memorial School. These 45 cases, their sampling date, 1 was on the 25th of May, 9 on the 27th of May. Saturday, Sunday, each had 13 cases reported, and this morning there were 9 cases. Aside from the Canadian International School and Pokoi Dang Pui King Memorial School, in the last 7 days, 14 schools had 2 or more cases. Now, 6 schools had 2 cases, but these cases initially they were from different classes, and there were no epidemiological relationship. They were probably community infected. 8 cases from 8 schools involving student-teacher mutual infection might be epidemiological related. 1 in international kindergarten. This additional case involved 1 new class, and they are different from the cases reported last week. This class, we have not detected any additional cases. The last day of going to school was 27th of May. 1 kindergarten, 2 primary schools, and 4 high schools have 2 to 3 cases. In our investigation, we found that In these 7 schools, the 2 to 3 cases each. Some are from the same class involving student teachers, and some might have had lunch together, and we have not found a sustained outbreak. So CHP will monitor the situation for further outbreaks. The number of deaths yesterday, there were 2 new deaths. And right now, currently, in the 5th wave, Hong Kong has accumulated 9,165 deaths. In DNA analysis yesterday, the public laboratories have found 4 suspected BA.2.12.1 cases in the DNA analysis. L452R, it's probably BA.2.12.1. So we have to await full DNA analysis to confirm whether that is the case. So to be safe, we're conducting epidemiological investigation and contact tracing. 3 cases come from the same family. They live in Hongqing Court, and previously there was another case that was related to the McDonald's cluster. The previous case was detected on the 18th of May. They face the different, their units are on different floors. Now, one case involved a 5-year-old girl. She had 2 vaccinations. On the 24th of May, RAT tested positive at night. Now, she, on 22nd of May, had been to a sushi restaurant, Bancheng sushi restaurant, and that restaurant will have to undergo mandatory testing. So a 35-year-old mother on the 26th of May had symptoms, and she had been 3 jabs. And the domestic helper, the 1-year-old female, also had symptoms on the 27th of May. The maid had 2 jabs, and she also tested positive from the RAT testing. The 2 other family members don't have symptoms and test negative. The last case involves a resident living in Taikushing, and on 26th of May, he had developed symptoms, and he also tested RAT positive. On the 25th of May, from 1345 to 1400, had lunch at Sunday Gay in the Saiwan Hall. So that restaurant also needs to undergo mandatory testing. His 2 family members don't have symptoms and also test negative. I also need to update some previous information. Our local BA.2.12.1 at the Canadian International School, that outbreak has 2 additional cases involving the previous reported clusters, including on a case on the 25th of May. His last day going to school was also 25th of May. On the 27th of May, PCR was negative. Another student developed symptoms on the 28th of May. His last day of school was 27th of May, last Friday, and the RAT was positive. He has a sibling also testing positive on 28th of May. His sibling also studied at the school, but in a different class. So this school has a total of 6 students in the same class and 1 teacher that are infected. And if you include the previous reported class, they are from the same family. So classes that have an outbreak, we suggest that they continue a suspension of class till Thursday. We have a holiday coming up, and so they will return to school next Monday. So students need to conduct RAT every day. Regarding Central Bar, today we have 8 new cases, and up till now, this bar cluster involves 23 cases, and it has 13 males, 10 females affected, and the Their symptoms developed between 20th of May to 29th of May, and one patron of this bar was a assistant coach at the school.
And the students participating in the basketball training. There's another student case, 29th of May, detected positive and was found positive during home quarantine. Last day of going to school was the 27th of May. As of now, this school basketball team, 29 students, total 8 are detected to be affected, and they are in 5 different classes. The other students are now still in home quarantine. Lastly, on Iron Ferry's outbreak, there are another 11 cases today. Of these 11 cases, 2, apart from going to Iron Ferries, they also went to Central Bar on the night, including a 30-year-old man on the 26th of May, onset with 3 jabs on the 29th of May. PRC test was positive. Another 29-year-old man, they know each other, are friends, and they had with injection, and 29th of May, PCR test positive. So Iron Ferry's outbreak, 6 men, 16 women, 18 to 45. And the onset date was 23rd of May to 28th of May. We went to the environment with 31 specimens collected, and they are all positive. HA, please. Thank you. 430 cases are in hospital, and for quarantined wards, 82. 14 are in secondary quarantine beds, and 32 are in the North Lantau Hospital, and 12 are newly diagnosed students. There are no new serious or critical cases reported yesterday. Of those in hospital, 10 are in critical situation, 8 are in critical situation, in serious situation, and 2 are in ICU. And there are 2 new deceased, one 65, the other 84 years old. Both are women. The 84-year-old is a dementia student, and he was found to have fainted. And it was found in the old age home, and it was found that there was hemorrhage in the brain. And on the 29th of May in the morning, she passed away. The 65 women patient had chronic disease, including liver sclerosis, and also peritonitis, and also high blood pressure and high cholesterol, etc. She checked into the hospital, and her CT value was 25.6. And on the 29th of May in the morning, 9 a.m., she passed away. 36 patients recovered, and 23 had left hospital. There are 51,761 patients who have already recovered, and 49,670 left hospital, and including cumulatively, there are 78,700 cases which are recovered, and 62,600 already left hospital. As for staff, there are 23,230 staff members recovered, and 23,000 plus who have reported back to work. Now, tomorrow we will have the 3rd phase of the vaccination pass, and according to the time and dose of vaccination and whether there had been a confirmed case for the individuals, there will be different treatment. Now, we urge that the citizens, first of all, check in their Leave Home Safe records whether they have all the electronic records for vaccination, and also whether there are other vaccination pass such as recovery QR code or medical certification. Concerning vaccination electronic records, if after the vaccination there had been a confirmation of COVID case, evt.gov.hk is a website you can go on to upload your vaccination records, or you can use the other electronic means, including the e-medical records, to upload the information. So, for instance, if you recently had the third jab, then you have to make sure that your vaccination record, the third jab, had already been inputted into the Leave Home Safe, so that in the third phase of vaccination policy, you can go into the relevant venues. After the 1st of April, the government had been using the new version of electronic vaccination records with the date of birth and also vaccination date and the recovery date, so that it reflects accurately through QR code the relevant information, especially for those who have recovered from the disease. Now, for citizens, you have to be sure that the records is comprehensive. And the easiest way to do that is to download the information from evt.gov.hk. And this is very simple. With a mobile phone, you can input the website, evt.gov.hk, and you see the web page. And on the right-hand side, you have a vaccination record choice or option, and you put in the relevant information. You have a Hong Kong resident, you input your ID card number and the certification date, and then you will be able to download the electronic vaccination record. And I urge citizens to, as soon as possible, store this into the Leave Home Safe app. There is a video to demonstrate the EVP website, how you can download the vaccination records. The process is very straightforward and it's very fast. If you have any inquiries, you can go to our specific web page to look at the relevant information and the short videos, or you can call the hotline 26263066. It is operational from 7 a.m. to 9 p.m. to help citizens. On the 23rd of May, since this was introduced in the past 1 week or so, we have already handled over 10,000 citizens' inquiries. Over 99% had been resolved immediately by hotline staff, and the 1% was actually supported in the back end by my colleagues in the information office. And citizens can go to the 25 MTR stations, mobile support stations, and there will be face-to-face support from 9 a.m. to 6 p.m. by the relevant staff. The existing version of Leave Home Safe and the QR code scanners, according to the conditions, they will be checking the relevant QR codes, whether they are compliant. If you want to know whether your vaccination records is compliant, you can go to the main page of Leave Home Safe, and there is a vaccination record button. And if you go into it, you will see whether your QR code has a blue frame to it. If it is, then it is compliant. If it is red, then it is possible that you do not have the relevant vaccinations, or you did not upload your vaccination records into the Leave Home Safe mobile. For those recovering within 6 months, you can also input the QR code into the Leave Home Safe for your recovery status. I would want to mention that for restaurants and also merchants, their QR code scanners automatically reminds the operators that the new version has to be used.
90% of venues have already updated to the latest version of 4.3.2. Now, I urge other venues to update their app as soon as possible. So you can press the auto update button on the mobile app. So when the program detects a new version, they will update automatically. So after updating, we can ensure that the scanner can comply with the latest vaccination policy. So that is my report for today. It's now Q&A time. Please identify your outlet. I have the following questions. Now, recently, we've had a lot of clusters and mutated version. So how does CHP assess the latest trend? If Hong Kong has a large outbreak, does the government feel it needs to tighten the policies? Now, the bars also have clusters, and the bar owners say that the guidelines are not clear. When the government legislates, they do not define whether DJs are defined as live performance. So should the government update its guidelines? Now we have an extra student who tested positive. So his class, is it on the same floor as the previous class that got infected? Did they get infected because they shared facilities? Did they remove their masks for having meals, or did they conduct other high-risk activities? Thank you for the question. The first question about the trends. Now, when we look at the different data, including the daily new reported cases and severe cases, the number of hospitalizations, ICU cases, and deaths, and also sewage testing, mandatory testing, community positive cases. In the last few weeks, it has stayed at a stable level. Now, for the daily reported cases, there's some volatility, but it is still rather stable. So the public need not be too concerned about the volatility. We just need to focus on short-term trends. Currently, social distancing policy and other measures are being relaxed, and the community has 200 cases plus per day. So that indicates that there's still a certain extent of transmission in the community. So we forecast that there still will be transmission in the community, and the level will hover around the 200 mark. But we need to monitor whether there is a sharp uptick or continuing uptick, and whether the figures are stable. We will not rule out some new mutations, such as Omicron. So when it will occur, it's unpredictable. Now, in the coming future, the public need to get vaccinated as soon as possible, because scientific data indicates that vaccines are effective against severe symptoms or even death. The second question was about the bar guidelines. So FEHD, when they issue a license, they have requirements and measures that need to be complied with. So you might have to consult the relevant department. The third question was about the international kindergarten, and they have a new case today. But this case, the class that reported the case and the 3 classes that were reported last week, they are different classes. So this class only has 1 case. Other students, roughly 17 students in 1 class, and the other students and teachers tested negative. Our understanding is that students at school, they wear masks most of the time. So they are very young children. They might not be wearing masks properly all the time, but we have not detected an outbreak. But we will keep an eye on developments. It's a large school. It has many classes on the same floor. So regarding shared facilities, typically they don't share facilities. They will share washrooms, but when one class uses, then the next class will use it. It's not mixed. Now TV, the central bar. I'd like to clarify, what is the current investigation aside from environmental samples? Have you found the source? Is it the DJ's? Is the DJ the source of infection? And what is the contact tracing? Will law enforcement follow up? Because DJs, have they visited other bars in the area? Are you worried that there might be an outbreak amongst the bars? The second question is about schools. You said a lot of schools have more than one case, especially the basketball team had a lot of students infected. So the school was suspended for 2 days. And what is the risk of infection in schools? So many schools have suspended for 2 or 3 days. And lastly, I'd like to ask the vaccine pass. Just now, you said that 90% have updated their apps. So the remaining 10%, how many venues have not updated yet? What type of venues are they? So when the policy is implemented tomorrow, are you worried that there might be some chaos? How do you ensure that the operation is smooth? Because we have hundreds of thousands of citizens who are scheduled for the third jab. The first question was about the bars. The 2 bars are still being investigated. So the number of patrons affected were patrons of a particular night, and we have not detected staff being infected. Now, some staff are still waiting for the test results. The 2 bars have had more than 700 patrons during the period in question. They had scanned leave home safe and so on. So we will follow up these people and their test results to see whether they have tested. So we believe that through mandatory testing, we will probably detect new cases. There might be cases with no symptoms. They'd have to get tested to know that they were infected. Initially, we believe that these 2 bars, the outbreak was probably due to an infected person who entered the premises. The similarity between the 2 bars is that when patrons visit, the patrons did not wear masks. Some people were consuming alcohol. They might be dancing, and the number of patrons were rather large. And we believe it might have been a very crowded venue, and they were in close contact with one another. And currently, if you look at the 700 patrons, and each cluster has some 20 cases, we'll have to see whether there are any new cases. The environmental testing, we will have EMSD look into it. They looked into ventilation, so that we're still waiting for EMSD report. Initially, these 2 bars, the ventilation system is not ideal, and probably have insufficient fresh air, and there were a lot of patrons. So the air change was not sufficient to if there was an infected person in the premises. So we will follow up with FEHD. Your second question was about schools. We have a new case today. Typically on Monday, we'll have more cases because schools will, after school leaves on Friday, if there are positive cases, and on the weekend, these positive cases, if parents report to the school, we'll notify the government.
即係入翻落嗰個
And we would put this into our records to calculate the total. Now, for today's cases, 10 cases were sampled Friday or before, and 13 Saturday, 13 Sunday, and 9 were positive today. And for those with outbreaks, the schools, there are 3. That's Canadian International, Bok Lai Tong's Pui King Memorial School, and also last week's International Kindergarten. As for the other schools, some of them would have gatherings within the same class. There would be 2 cases, and we understood that perhaps they had after school eaten together, or some of them would be one teacher and one student, and we have suggested that the schools do comprehensive deep cleaning and also to monitor the RAT testing of the students. And we may suggest that where there are more cases, some of the classes would stop class. Now, as for the basketball team, that's a different situation. It was not spread within the classroom, but the teammates, we believe they have participated in a training session on 24th of May without masks on and have been infected. They have all received vaccination. They had, during the basketball activities, took off their masks. To be cautious for the other students in the team, we are asking them to have home quarantine as close contacts. And this morning, the school did not have new cases reported. Yes. I'll answer the third question concerning the vaccination pass. There are 90%, as mentioned, for the venue scanners which have been upgraded or updated. Those which are not updated, tomorrow they will not be able to use a scanner. If they want to do so, update them, they should connect up to the internet and to update the scanner appropriately. AM 730. Question. Honking Garden Block 3 for the PRC test, was it negative or positive? And for the 5-year-old girl, which school is she going to? And is she one of the cases from the quarantine groups? Now, for the hotels or the 2 bars, I would like to know what is the transmission between these 2 outbreak cases, and what time did these 2 persons who went to both bars went to the bars? And also concerning the schools, does it include the Taikushing International School and the Yunnan one? And just now it's mentioned that there was a teacher and student both confirmed in the outbreak. Is it because of during teaching, during class, or did they was it that they have activities outside of class? And if the former, do the classmates have to be quarantined? Now, concerning the 3-person family in the residential court, you remember that for this residential building, there was a family related to the McDonald's group, and they had to be quarantined. For the 3 additional cases, the mother and the helper in their PRC test 21st and 22nd of May were negative, and the onset for the mom was 26th and 27th for the domestic helper. And we believe that on the 20th of May or after that date, they had been infected. As for the cases before that, they were tested positive on the 18th of May, and there is no real proof, but we do not rule out the possibility that going in and out of the residential block that they were infected. And we found that for this family, they have not been to the McDonald's group or the same block, another family common places of visit, none. But they're in the same residential block. There may be transmission inside the block, but we will have to wait for the sequencing result to see that they are indeed BA.2, .12, .1 strains. And also we have to look at the family's genetic sequencing to see whether they are the same. But in the community, there are a few BA.2, .12, .2 cases. So we believe that there may be epidemiological relationship. And the two persons for the two bars on the same night, the two persons have been to both bars. And as I've mentioned, they know each other. On the 26th of May, one was infected, and this person, 26th of May onset. For this person, we believe it is possible that he was infected on the 22nd of May going to the bar, so he may not be a source. The other one is asymptomatic. On the 29th of May, he was tested positive with the PCR test, and these are the two only persons who have been to both bars on the night. As for the source for the two outbreaks, we are still investigating that. And earlier, the Central Bar, there was one person with onset on the 20th of May, light symptoms, and he was at the bar as well. So was he the source? We will have to find out. And we also have to look at the results of the other patrons' tests. As for Iron Ferries, the earliest onset was 23rd of May, and we believe that he is not the source. We have to look at the other 700 people, their testing results to see whether there were earlier onset cases. As for schools, the 14 schools does not include, excuse me here, let me just find the relevant records. The International School and Pok Oi Memorial School are not included. The 14 schools in the past 7 days have basically 2 cases each, and a minority of them have 3 cases. And for 6 schools, the cases are proven to be unrelated, and they're from different classes of the school. So I believe that they were infected in the community. There are 8 schools where they have small outbreaks with 2 to 3 students involved for each. Let's say in a class as a teacher and one student infected at different times, or their symptoms appeared at different times. And there are other cases where there are 2 to 3 students eating together and infected. And so far, there is no proof that for these classes in these schools, there's continuous transmission. But if there are new cases, we will see whether we need new measures, such as cessation of class for these schools. Now, preliminary information indicate that the 2 patrons first went to Iron Ferries, and it was 10:45 p.m. according to the records, and they stayed for half an hour, and then they went to Central Bar. An English question, please, the lady at the back.
Thank you. Thank you. So this is a question from SCMP. Would like to ask Dr. Au that it was reported that there were DJs hired to play music and patrons without masks who have been dancing at the 2 affected nightclubs. So will the CHP take any follow-up actions on this? And what is the capacity of the Central and Irons Ferries bar? Did they exceed their 75% capacity limit, given that at least 700 people had visited each club that day? And second, for the patrons who have both visited Central and Irons Ferries, are they classified as a super spreader? Were they among the first batch of people who reported symptoms? And third, could you please clarify if DJs are hired if DJs are hired to play live music, does it fall under the category of live performance under the regulations? Some operators said that the government did not explain the requirements detailedly, and thus they had overlooked it. Will the CHP follow up on that? And lastly, did the CHP discover any other clusters apart from those uncovered at restaurants, clubs, and also schools? Thank you.
Thank you for your question. For the first question, concerning the 2 bars with outbreaks, our preliminary investigations reveal that all cases affect the customers of the who have patronized these 2 bars in the evening on the 21st of May. So far, there were no staff affected, but however, we need to chase their testing result. We are not aware of any infected DJ who had been to these 2 bars on that evening. For the capacity, according to information from the Food and Environmental Hygiene Department, the capacity is around 300. So the 700 or over 700 customers recorded through the vaccine pass data are cumulative number of customers who had visited these 2 bars during the whole period. For the first bar from 11 Central from 11 p.m. on the 21st of May to 2 a.m. on the next day, and for the other bar is from 9 p.m. till 2 a.m. in the next days. So we are not certain whether there is any violation of the maximum capacity. It needs further investigations by the enforcement authority. We have referred the cases to the Food and Environmental Hygiene Department to investigate whether there is any violation of Cap 599F. And I don't have detailed information at this moment. For the two patrons who have visited both bars on that evening, there is no evidence that they are super spreader. One had onset of symptoms on the 26th of May and was tested positive on the 29th of May through the compulsory testing. But however, the CT value is not low, is over 25. For the second case, he is asymptomatic and also tested positive on the 29th of May and with a CT value over 25. So there is no evidence that they might be the sources of the super spreader, and we will continue our investigations to identify if there are other cases arising from among the customers. I think this is under the purview of the Food and Health Bureau and also the Food and Environmental Hygiene Department, and I think they will take into consideration of these 2 incidents and also to see if there is any need to review the regulations.
下一位，呢邊在前嗰位男士。
I'd like to ask the 2 bars were overcrowded, and experts say that 700 plus patrons, they might have contravened the regulations. So will the government manage the number of customers? How do you ensure that the regulations are complied with? So are there any measures in mind? Will you adjust the bar's operation policy? Thank you for the question. Regarding these 2 bar clusters, epidemiological studies, it indicates that during the concerned period, more than 700 patrons had entered the premises. Now, did they contravene the regulations? We'll have to wait for law enforcement departments' further investigation. But initially, we feel during the concerned night, it was overcrowded and not ideal. A lot of cases reflect that. There were a lot of people, and they were at they were in close contact and they didn't wear masks. Because people consume alcohol, they remove their masks, there is risk attached. But fortunately, we have vaccination pass, so patrons were vaccinated, and we also expect that in the future these premises are high-risk premises. There will be outbreak. It's just that if everybody is vaccinated and when you enter high-risk venues, if there is an outbreak or infection, then if you are vaccinated, it can prevent severe symptoms and also reduce the risk of death. I'd like to follow up on the bars. Doctor mentioned that patrons say that they had removed the mask and danced. The social distancing policy, if you remove your mask and dance on the dance floor, have they contravened social distancing rules? Will there be follow-up action, including prosecution of people who contravene the rules? So today there is 4 more additional mutation cases. They live in Taikuxing and are related to the McDonald's cluster. So does CHP have measures to control or prevent the mutated virus from spreading? And how do you assess the mutation, the spread of the mutated virus? Well, removing masks, our guidelines are if the public frequent high-risk venues where you remove your mask, there is a risk of infection. If there are invisible spreaders, then they can transmit the virus. In terms of risk control, we can increase air ventilation and reduce this risk of spread. So even if one enters these premises, you should wear your mask except when you're eating or drinking. And under F599F, this is not the ambit of CHP, so you would have to consult FEHD or other law enforcement departments. That is the requirements for wearing masks in these premises. Your second question about Taikuxing, I want to clarify that BA.2.12.1, this subvariant is not a new mutation. It is a subvariant of Omicron. It is not a brand new mutation. So Omicron is a variant. It is a subvariant of BA.2. There's also BA.3, BA.10. Why are we concerned about BA.2.12.1 is because WHO published initial data indicating that this subvariant is more infectious compared to BA.2 or BA.1. But the risk of serious symptoms or death, there's no evidence indicating that it has a higher risk. For the 4 new cases in Taikuxing, we've discovered that there is no direct epidemiological connection to the other BA.2.12.1 cases. For the Honging Garden family, there's another family that lives in the same building. They might be a connection, but that male doesn't have any epidemiological relationship. The only common thread they have is that they live in the same district. They live in Taikushing. The McDonald's cluster was also in Taikushing, so we feel that South Gaywan, Taikushing, in the last week or two, they have an invisible transmission, and that leads to the infection. And we are following up with the cases, and the male that we reported today does not. We don't know the source.
所以我哋都即係如果佢哋去過一啲高風險嘅場所咧，都會列為需要做強制檢測啦。亦都係佢哋嘅大廈亦都會列為需要做強制檢測啦。咁希望如果喺當區嘅居民如果出現病徵嘅時候咧，一定要即係自己要做快測啊，或者係盡快做一個核酸檢測，以至到即係受到感染可以即係盡早發現。
下一位，呢邊呢耳行黑色衫呢位女士。
你好啊 ，Cable 嘅。咁我想問下，即係見到今次酒吧即係重開短短幾日啦，已經有顧客即係面周圍走同埋跳舞啦，即係會唔會加強即係呢個巡查同埋執法？唔該。
我哋相信即係酒吧其實即係開放翻之後咧，佢一定係要遵守翻第599章 App 下面呢一啲嘅處所嘅規定嘅。咁包括喺即係環境啊，同埋嗰個即係通風啊，另外就係即係疫苗通行證嗰個要求方面啦。咁我相信相關部門就住呢1、2宗嘅群組嘅爆發咧，會審視翻即係究竟有冇需要係即係做一啲嘅額外措施啦。咁呢個因為個流行病學調查或者係實際出現爆發嘅原因仍然都係調查。咁我諗都係即係暫時都係一個。
So epidemiological connections and also the sequencing are still being done. So we will consider whether there will be need to have further restrictions or other measures in these premises. The gentleman at the back, please. Last question.
You found out how the virus spread in the 2 bar clusters in Central, and also you said it's still unclear whether the 2 bars have violated any social distancing rules. But would you recommend bars to stop hiring DJs to play live music at the moment? And given the outbreaks, does the government think that there is a need to tighten the restrictions at bars? And also, you report a number of outbreaks at schools. Is that a worrying trend, or is that something within your expectations? Thank you.
Thank you for your question. The first question is on the transmission or the outbreak in the 2 bars. Our preliminary investigations reveal that most of the cases, or even nearly all of the cases, have taken off their masks while they visited these 2 premises. In that evening, we suspected that there might be an infectious person who are carrying the virus and who have patronized these 2 bars and causing the transmission in an enclosed environment with inadequate or poor ventilation. And also many of the people, because they took off their masks, and this will increase the risk or cause the infection. And according to information provided by the cases, on that evening, the environment inside the 2 bars are quite crowded with a lot of people. So this will decrease the social distancing between the people. And also they have high-risk activities such as drinking, and also they have dancing. So we suspected that this might be the factors causing the outbreaks inside these 2 bars. For the question on the DJ, I have no further supplement, because this is under the regulations of the relevant authority, including the Food and Health Bureau, and I think they will look into the issue, and if there is any violation, they will take the necessary enforcement actions against the bars who have violated the CAP 599F. For the situation of the schools, we think that it is within our expected. The number of positive cases is expected, because there are still a lot of transmission chains in the community. At the current moment, there are over 200 cases per day. So it is expected that, or normal, that students or teachers or staff of schools will acquire the infection in the community. And The most important thing is that they need to do daily RAT tests, so that if they are infected, they can abstain from attending the schools and prevent any outbreaks or transmission inside the school.
今日記者會完結，多謝大家。
Thank you very much. Thank you for coming.